Hi everyone, and welcome to today's live show. We are going to be talking about breastfeeding when your baby has jaundice. Of course, I am joined once again with the very, very special Dr. Robyn Thompson. Hello, Robyn. Would you like to say anything about breastfeeding and jaundice?
Kelsey, I'd love to join you in that. Please, go. I don't say that I know everything, but, you know, over our career, we learn lots with newborn jaundice and, you know, continuing jaundice. Yeah.
And today we are going to be discussing what those two mean. And Dr. Robyn's also going to be touching upon something you may not have heard of. It's called breast milk jaundice. So I really am not very clued up on this subject. I've done some research, so Dr. Robyn will be guiding me actually through today's session. But we are going to be discussing common topics surrounding this, and we're also going to be getting some common questions answered by Dr. Robyn herself. So please do stay tuned. And if you'd like information on our online education, which has a wealth of resources on everything you need to get started and also learning all about jaundice, do comment below. We love connecting with you guys. If you're pregnant, congratulations from us both as well. So Robyn, would you be able to start possibly with a brief explanation of what is newborn jaundice?
So newborn jaundice is the yellow colour of the skin. It starts to go yellow. It may be yellow, you know, soon after birth. It may be yellow a few days after birth, a couple of days after birth. And it's the circulating bilirubin, the bile is circulating, and then we have to work, the baby has to work through a breakdown process unless there is a history of incompatibility where the mother might have an Rh negative group and the partner might have a positive, and the baby may have been genetically given the positive blood group. So then we have an incompatibility, and those little babies offer, I can't tell you the statistics of how many. I don't think it's that many, but they will need a blood transfusion often if their bilirubin levels go too high and stay too high too long. It's a medical problem. Needs to be. I've got a nasty little fly hanging around here.
We've got a friend. We've got a friend joining us. So I actually found some interesting statistics whilst you're talking about it. So only 1 in 20 babies will actually need will actually have a blood bilirubin level high enough to need treatment, which surprised me, because obviously we understand that jaundice is quite a common health condition for newborn babies. But to hear that it's only really concerning for 1 in 20, it's a really interesting and helpful fact, I think, because it can be super worrying, especially if you're a new mum and you haven't heard of it before. So like you said, it's to do with the bilirubin levels, and it causes yellowing of the skin and in the whites of the eyes, like you said. And it's to do with the... Sorry.
I just need to say, we do need to observe carefully. It's not something that we're you know, complacent about. We must observe carefully, because if the jaundice goes on too long, there is a condition called kernicterus. And kernicterus, the baby can be very sick. So we need to avoid that sort of thing and watch the baby's jaundice level. So I think you're about to say the conjunctiva, the whites of the eyes. We look at that. We look at the baby's face, and we look at if the jaundice is extending down the neck, down the chest. Sometimes it extends to the arms, and you can see it's moving. So that is a concern. We don't want the baby to have a body that's covered with yellow. So we try to look at and see. Then the next best thing we do is look at the output for the baby to be sure that the liver is metabolizing, the binding process is working. The binding process is binding the jaundice, the bilirubin levels, and the liver's breaking it down, and then it's excreted through the bowel and the urine. So the next thing we look at is the urine and the bowel movements. And usually if a baby's quite jaundiced, you'll see very yellow poos. You'll see quite yellow urine. So again, it's about careful observation. It's careful observation with the mother included, so that she's reassured not stressed about it, and knowing what the medical advice might be and how to go about it. Most babies who do need care with jaundice, it's under the lights, and the ultraviolet light starts to break it down through the skin. And, you know, I don't know how many days each unique baby would be there for, depending on the circumstances, but that's probably the least common. Most babies will have a yellow appearance for a while and then it just dissipates. And as it dissipates, you'll see it breaking down by their output as well. And I have noticed over my 50 years of midwifery that since we started giving vitamin K and Hep B to the babies at birth, that there was always a jaundice response to that. So I wonder, and I ask the question, does the baby's liver react to the drugs that are used? Vitamin K and Hep B, does vitamin K, these are the questions. Does vitamin K have an influence on jaundice? Does Hep B, does the two together have a more increased influence on jaundice?
We actually have a fantastic post that we can share by Sarah Wickham, who is a wonderful researcher who Dr. Robyn loves herself as well. So we'll pop the link for that post down below. So you can make yourself an informed decision and have a look at all the information she's researched surrounding the.
Yeah, very important. Sarah's a great researcher and has written it so that everybody understands it. You know, it's not written in language.
No jargon.
No, and it's not high scientific language. She gives you all the research and the information, but explains it in a way that is much more beneficial to the mother when she's concerned. We don't want to stress and distress these mothers.
Absolutely. Doing your own research on a topic surrounding birth or breastfeeding can be difficult sometimes because they do love to use those big confusing words. So should we be encouraged then to continue breastfeeding if our babies are jaundiced?
Absolutely.
I want to be clear that this is at a level, we're talking solely today at a level that's not considered dangerous.
Well, that's right. If we're talking about the jaundice, then also there is a known what's labelled the breastfeeding jaundice. But again, I'm not sure whether it's breastfeeding or what is coming through the milk that the mother's already had in pregnancy. Maybe she's had, various things in pregnancy. It could be that's affecting. But what happens if you keep breastfeeding? The binding process continues, and the binding process is the breaking down of the serum, the blood bilirubin. So the serum is the blood, the bilirubin in the blood, it starts to break it down. So it's very important to continue breastfeeding. And just observing that the bilirubin levels don't increase rather than they're slowly decreasing, gradually decreasing. That's the important thing. Yeah. Go away.
And like you said before, our friend is back. Like you said before, keep communicating and observing alongside your midwife or your healthcare practitioner, and use your motherly instincts.
Yes.
Right, Robyn, you taught me that. You allowed me to be confident in following my instincts. Thank goodness.
So, yes, very important.
Yes, I agree. So in a small number of cases, jaundice can be the sign of underlying health condition, like you said. And this is often the case if it's developed shortly after birth. Would you agree?
Yes.
Within the first 24 hours.
Yeah.
And many women are encouraged by health professionals to introduce formula top-ups or other treatment options at this stage. And of course, that's something they'll discuss with a healthcare practitioner. But what happens if they are encouraged to flush out, which is one of the phrases we hear quite often, a breastfeeding jaundice, which is developed after 48 hours and the bilirubin levels are at a safe level? What would you encourage a mother to do at that point?
Continue breastfeeding. And you would do repeat bilirubin levels. And you would have eliminated that there's an anti-D problem, that there's a blood incompatibility problem. You would have already done that. So if you think that, and if you know there's an anti-D problem or a blood incompatibility problem in pregnancy, I note now that they're actually giving the anti-D in pregnancy, which in my time we had to give it within 72 hours of the birth. So again, I'm not sure what the absolute practices in different parts of the world, because we do often see there are differences. And I haven't, be honest, kept up with all that detail.
And it changes so often, it's hard to keep up with it. I know that in the UK, they still do the same. They offer in the first 72 hours.
That's right. So having the knowledge in pregnancy is wise. Having the knowledge of a family history is also wise. Having the knowledge of your own history and how you feel about this. Knowing what you're swallowing in pregnancy, because I do believe there is a connection. There's definitely a connection for other reasons, taste and smell of breast milk and baby's behaviour. We see that commonly in our practice. I am concerned about opiates in labour, what that's doing for the baby's liver to have to bind and process that and eliminate through elimination through urine and bowels. So I ask a lot of questions. I don't know the answer to every question, but asking the questions makes us think about it more and discuss it more. And it might even encourage more research from various people when we start asking more and more questions. So as far as the jaundice goes, that's, you know, newborn jaundice, neonatal jaundice, keep breastfeeding and try not to use other types of milk, because the baby has to work harder to process that. Again, we don't say no, we say what that little baby needs and that mother needs at that point in time is the wisest thing to do, but preferably her breast milk for the binding process.
Wonderful. And it's also really interesting, in my opinion, to hear the different health advice and the different policies and procedures they have around the world. We chatted before we went on the show, and we said that in the UK, women are encouraged to continue breastfeeding unless there is a high or dangerous concern with the bilirubin levels. Whereas we have heard and seen that the policies and guidance in America, in the USA, is completely different to that. And actually, they would rather deal with jaundice from the beginning, and they usually encourage a top up of some sort that sometimes is with the breast milk, but usually with formula. So if you are around the world watching this video, you're curious, maybe you have a history with jaundice, maybe you have a blood type that you're concerned about, or if you just generally want to learn more, which is fantastic, this is the best time to learn more. Like Dr. Robyn said, be fully prepared and you will be able to make those informed decisions yourself. And then get in touch. We can help guide you towards the most relevant resources, which are always available in the online education, because Dr. Robyn peeled every level of her brain out and put her heart and soul into this education. Yep. And also and also there is the round the clock guidance and support from her wonderful team as well in the club. So do connect with us, and if you have any questions, get in touch as well. Robyn, did you have any last words to any mothers that are looking to, maybe they're experiencing it now, or there's something that they're worried about, seeing as it's so common, to stay confident in their body, in their breast milk, and to know that they will be able to see how their baby is doing?
Yes, and just to continue breastfeeding, you know, you do your blood group anyway when you're pregnant. Do your partner's blood group is a good way to be, you know, informed in advance. Not to let jaundice go without checking it regularly, because we don't want to develop kernicterus. If it's been diagnosed as breast milk jaundice, it will gradually just settle down, and generally that's something coming through the breast milk in my experience, you know. So again, like we've just discussed, just be aware and then watch the level of the jaundice. So if it's staying head, face, conjunctiva, it's usually okay. If it's a little bit lower, it's probably okay too. And we just don't want the, you know, the upper body and the middle body starting to be jaundiced as well. We need to keep a very close eye on those sort of things. And that would be talking with a medical practitioner or a paediatrician about that.
There you go. Well, I hope you found today's session helpful. I'm going to be back next week with one of our very special members, who is going to share her story with you on how breastfeeding her second baby has been a breeze compared to her first after she discovered the Thompson method. And I'm sure you'll love watching that one, Dr. Robyn. So thank you all for watching, and from us both, take care.
Thank you very much. Take care too. Lots of love. See ya.